The differentiation between granulocytes and agranulocytes holds significant importance in the study of immunology, as each cellular type fulfills distinct roles within immune responses and inflammatory processes. By comprehending these distinctions, healthcare professionals are better equipped to diagnose a range of blood disorders effectively. In the context of leukocyte development, a multifaceted process unfolds, which encompasses various classes including hematopoietic stem cells. These stem cells are instrumental in influencing leukocyte production, a critical mechanism that sustains a balanced immune system capable of mounting appropriate responses to pathogen exposure. Cytokines are pivotal in regulating leukocyte development, particularly through specific interleukins and colony-stimulating factors that drive the maturation of leukocytes. Acknowledging these regulatory mechanisms not only enhances our understanding of the immune system but also aids in elucidating the pathophysiology of blood-related diseases. Among the leukocyte population, neutrophils are especially vital, playing a crucial role in inflammation and host defense mechanisms, primarily through the process of phagocytosis. They employ oxygen-dependent mechanisms to effectively eliminate foreign microorganisms, with reactive oxygen species proving essential for robust immune responses. Transitioning to eosinophils, these cells serve as critical markers for identifying allergic reactions and helminth infections, actively engaging in the destruction of parasitic worms through exocytosis. An increase in eosinophil count typically signifies a targeted immune response towards specific pathogens, underlining their role in parasitic defense. Despite constituting the smallest proportion of leukocytes, basophils are integral to mediating allergic reactions and inflammation. Their existence significantly influences the body's responsiveness to various allergens and plays a role in sustaining microcirculation, thus illustrating their multifaceted contributions to immune processes. Basophils serve as precursors to mast cells and are actively involved in the degranulation process during allergic responses. This release of various mediators is essential for orchestrating an effective immune reaction, showcasing the importance of basophils in enhancing the body's defenses. The release of mediators, such as prostaglandins and leukotrienes from basophils, plays a critical role in modulating smooth muscle tone within blood vessels. This results in vasodilation and increased blood flow during inflammatory responses, highlighting their importance in the overall physiological response to injury or infection. Furthermore, basophils contribute to tissue regeneration through the secretion of growth factors that promote cell mitosis and repair of damaged tissues. This regenerative capacity emphasizes the broader significance of basophils beyond mere participation in immune responses. In addition, monocytes fulfill a vital cleansing function within the body by engulfing and destroying larger particles, including remnants of dead tissues. This activity not only enhances immune function but also supports the maintenance of tissue homeostasis. Lymphocytes, once differentiated into plasma cells, are responsible for producing immunoglobulins, which are imperative for antibody-mediated functions. These include the neutralization of toxins and viruses, illustrating the essential roles lymphocytes play in the adaptive immune response. The differentiation process of lymphocytes occurs primarily in the thymus, where they develop into various functional types, including cytotoxic T cells, helper T cells, and regulatory T cells. This specialization is crucial for coordinating and executing effective immune responses against diverse pathogens. In hematology, leukocytosis and leukomoid reactions represent significant concepts, reflecting increases in leukocyte counts that may signal underlying health issues. Recognizing these conditions is paramount for enabling timely diagnosis and appropriate management of potential health concerns. The leukocyte formula encompasses both relative and absolute counts of leukocyte populations, serving as an essential tool for assessing immune response. This differentiation not only informs clinical assessments, but is also critical for understanding a patient's overall health status. It is important to note that childhood leukocyte formulas exhibit significant differences when compared to those of adults, particularly with regard to the proportional representation of neutrophils and lymphocytes. These variations highlight the dynamic and evolving nature of the immune system across different developmental stages. Neutrophilia stands out as the most prevalent form of leukocytosis, frequently observed during inflammatory responses and various infectious diseases. This condition serves as a clear indication of the body's active efforts to combat infections and restore homeostasis. In parallel, lymphocytosis and monocytosis may manifest during chronic inflammatory processes and are often associated with conditions such as viral infections or autoimmune disorders. These responses provide invaluable insights into the functionality and adaptability of the immune system. The phenomenon of nuclear shifts is particularly relevant within the context of neutrophilia, denoting alterations in the ratio of immature to mature neutrophils. This shift serves as an important diagnostic marker, aiding in the assessment of immune responses. A left nuclear shift indicates an increase in banned forms of leukocytes and their precursors, suggesting a regenerative response to physiological stress or infection. Such shifts may signal the presence of serious health conditions requiring further investigation. Conversely, a right nuclear shift denotes a decrease in immature leukocyte forms coupled with an increase in mature leukocytes. This phenomenon is often linked to rare and specific health conditions, though its diagnostic significance remains lesser compared to left shifts. The condition of leukopenia, characterized by diminished leukocyte levels, may arise due to prolonged stress or chronic infections impacting bone marrow function. The transition from leukocytosis to leukopenia may indicate a deterioration in overall health status. Physiological leukocytosis is not accompanied by shifts in the leukocyte formula, whereas pathological leukocytosis shows distinct variations. This differentiation is crucial for achieving accurate clinical diagnoses and guiding appropriate interventions. In the context of pregnancy, neutrophilia typically presents without a left shift in the leukocyte formula, marking an important consideration for monitoring maternal health during this critical period. Leukopenia can stem from a variety of causes, including factors such as tumor metastases and aplastic anemia. Understanding the underlying mechanisms driving these conditions is essential for the accurate diagnosis and effective treatment of affected individuals. Agranulocytosis arises from various etiological factors, including autoimmune reactions and exposure to toxic substances like benzene, which disrupt normal blood cell production. Early detection in these cases is vital for ensuring optimal patient management. Similar to agranulocytosis, leukopenia may also be induced by radiation exposure and certain pharmacological agents, underscoring the importance of vigilant monitoring in individuals susceptible to these adverse effects. Given the critical role of leukocytes in safeguarding against infections, a thorough understanding of agranulocytosis proves essential. A significant reduction in leukocyte populations can lead to opportunistic infections, posing serious risks to patient health. The syndrome associated with agranulocytosis presents life-threatening risks and can result in severe infections if not promptly addressed. Therefore, comprehending the underlying causes and pathophysiological mechanisms is essential for effective diagnosis and timely intervention. Furthermore, agranulocytosis can be precipitated by medications, including nonsteroidal anti-inflammatory drugs, NSAIDs, thereby highlighting the need for monitoring adverse drug reactions. Being aware of potential consequences associated with pharmacotherapy is crucial for ensuring patient safety. Lastly, autoimmune agranulocytosis may emerge from a range of underlying diseases, leading to decreased resistance against infections. Common symptoms associated with this condition include sore throat and inflammation of mucous membranes, emphasizing the need for vigilant clinical evaluation.